الأول بحب أشكر أستاذي ومعلمي ودكتور عبد الحفيظ شهاب الدين، وأشكر الدكتور رمضان على توجيهاته لينا. هنتكلم النهاردة عن الجنرال كرينيال امبريولوجي. عشان نبدأ بالجنرال كرينيال امبريولوجي أو نتكلم عن الجنرال كرينيال امبريولوجي، هنتكلم عن حاجات بسيطة كده في الامبريولوجي، اللي هو السبيرم بيلقح الأوفري، بيعمل لنا الزيجوت بيحصل لها في الأول مايجريشن وبعد كده امبلانتيشن في اليوترس، وبتبدأ من أول ما بتبقى زيجوت بتبتدي الانترايتراين لايف، بيبدأ في الفالوبيان تيوب، يعدي بعد يوم بتبقى عدد الخلايا فيها 2 خليتين، بعد 5 أيام بتوصل ل58، بعد 6 أيام بيوصل ل117. ده من بعد الامبلانتيشن. النيورال تيشو او النيرفس سيستم بيتكون من the nervous system is consist of 3 parts. Central nervous system include the brain and the spinal cord. دول derivative from neural tube. Peripheral nervous system include nerve cell outside the central nervous system and cranial and spinal nerves that connect the brain and spinal cord with peripheral structure. وآخر حاجة بيتكون من autonomic nervous system has part in both CNS central nervous system and peripheral nervous system. It consists of neurons that innervate smooth muscle, cardiac muscle, or glandular epithelium, or combination of these tissue. The central nervous system, CNS, is derived from ectoderm, the outmost tissue layer of embryo. The central nervous system appear above the notochord. It appear in 3rd week of intrauterine life as neural plate first, neural groove second, third forming of a neural tube by adhesion of 2 neural fold. زي ما هو باين في الرسمة عندنا. النيورال بليت هي عبارة عن سيكنينج في الاكتودير، في اللاير بتاع الاكتودير يحصل سيكنينج الأول. بعد ما بيحصل سيكنينج بيحصل فولدنج للاتنين لاترال اند، هيعملوا لنا نيورال فولد. بعد ما يحصل الفولدنج ده هيلزقوا في بعض ويعملوا لنا نيورال، هيحصل ادهيجن ويعملوا لنا نيورال تيوب، وفوق منها نيورال كريست. مع الوقت النيورال كريست بتتقسم على الاثنين لاترال بتوع النيورال تيوب. يقول طيب هناخدهم حته حته. نيورال بليت thickening of the ectoderm extend from procaudal plate in front to caudal end of the embryonic disc behind, forming neural groove. The neural groove elevated edge called neural folds. The neural fold fuse together, forming neural groove into neural tube, lining beneath the ectoderm in the median plane. Neural tube. The fusion of folds is absent at the anterior and posterior end of the tube leaving two opening on the ectoderm called the anterior and posterior neurobrose. Later, the anterior neurobrose close at 32 days. The posterior neuropore close at the 25th days, 2 days later. Neural crest formation. It arises as strip of ectodermal cell sited along the lateral edge of the neural groove. As the two edges of the neural groove fuse together, forming the two neural crests, appear as two longitudinal cords that migrate ventrally to lie one on each side of the neural tube. Neural crest derivatives. The neural crest becomes segmented into mass, which gives the following derivatives: sensory ganglia of cranial nerve 5, 7, 9, and 10. Autonomic ganglia of both sympathetic and parasympathetic. Dorsal root ganglia of all spinal nerves. Neurolimbal Schwann cell of peripheral nerve. The medulla of supraadrenal gland. Chromaffin cell. Melanoblast of the skin, which produce melanin pigment. Arachnoid and albia matter, which are ectodermal, but not the dura mater, which is mesodermal. Development of the brain. اما بتقفل النيورال تيوب بيبقى فيها فيزيكلز. لما بتقفل على حويصلات او على فولز. الفيزيكلز دي هنقسمها لبروزسيفالون وميزنسيفالون ورومبيسيفالون. رومبينيسيفالون. كل فيزيكل من الفيزيكل ديت بيحصل لها فيسكولاريزيشن، بيبقى جواها بتكون فيزيكلز تانية او بتكبر بشكل مختلف. في منها اللي بتتقسم لاتنين فيزيكل لاترالي، في منها اللي بتتقسم اتنين فيزيكل من فوق ومن تحت. from above from down. هنتكلم عنهم بالتفصيل من تحت لفوق. يعني هنبدأ بالهايند برين او الرومبينسيفالون، وهنخلص بالفور برين او البروسينسيفالون. Development of the brain. The brain develops from the cranial end of neural tube as the cranial end of neural tube expand to form the brain swelling. The two constructs appear in the brain swelling, dividing into three parts called brain vesicles. Forebrain or البرونيسيفالون, midbrain or الميزنسيفالون, hindbrain or الرومبينسيفالون. The three brain vesicles differentiate as A. Forebrain give two optic vesicles, the future eye, then divided into median part called diencephalon. Two lateral diverticula called telencephalon vesicles, the future cerebral hemisphere. Midbrain remains undivided. The hindbrain give rise to the following derivative: metencephalon, which form el pons and medulla; melencephalon, which form the medulla oblongata. Flexure in neural tube during the fourth week. Folding of neural embryo is also taking place. So by end of fourth week, two flexors are above in the neural tube. Cephalic flexure, it is located in mesencephalon region. Cervical flexure, it is at the junction of rhombocephalon and spinal cord. Vesicles of brain. Telencephalon consist of mid narrow portion and two lateral dilated portion called primitive cerebral hemisphere. The cavities of the cerebral hemisphere called lateral ventricle. Diencephalon is characterized by outgrowth of optic vesicle. The cavity of diencephalon is third ventricle. The cavity of a rhomboencephalon is the fourth ventricle. Development of brainstem. As in the development of the spinal cord, the lateral wall of the brainstem are connected by a thin roof plate and a thin floor plate, and will have ventral basal lamina containing motor nuclei and dorsal alar lamina containing sensory nuclei. Column of basal lamina. Somatic afferent column most medial. It lies close the midline in line with anterior horn cell of the spinal cord. Its efferent fiber supply somatic stride muscle derived from somatis. It differentiated into 12 nucleus in medulla, 6 nucleus in bone, third and fourth nerve nucleus in midbrain. Special visceral branch, efferent column. It lies lateral to somatic efferent column. Its efferent fiber supply the muscle derived from branchial pharyngeal arch. It differentiated into nuclei, a fifth and the seventh nerve motor nuclei in the bones. A ninth, 10th, 11th nerve motor nuclei in the medulla, which join together forming nucleus ambiguous. The column of basal lamina. General visceral efferent column lies just lateral to special visceral efferent column in line with autonomic lateral horn gray matter of spinal cord. Its efferent fiber are parasympathetic supply, visceral smooth muscle, and the gland. It differentiated to the nuclei, dorsal nucleus of vagus in the medulla, inferior salivary nucleus of glossopharyngeal nerve in the medulla, the superior salivary nucleus of facial nerve in the bones, Edinger Westphal nucleus of oculomotor nerve in the midbrain. The column of alveolar lamina. The alveolar lamina form four sensory afferent column. General visceral afferent column It is the most medial sensory column. It receives afferent sensory fiber from viscera. It represented by sensory component of dorsal vagal nucleus. Special visceral afferent column اللي بعد منه اللي هو lateral له. It just lateral to general visceral afferent column. It receives taste sensation from tongue epiglottis. It is represented by nucleus of Trochus solitarius. نطلع lateral ليهم. General somatic afferent column lies lateral to the special visceral afferent column. It receives afferent sensory fiber from the skin of face, scalp, proprioceptive sensation from muscle of mastication. This column differentiated into three sensory nuclei of trigeminal nerve, spinal, main sensory, mesenteric. Special somatic afferent column. It is the most lateral column of Alar lamina. It receives auditory vestibular fiber of vestibulocochlear nerve. It represented by vestibulocochlear nuclei. Margination of nuclei, neurobiotexis. Some of the motor nuclei of cranial nerve migrate from their original position toward chief fiber tract from which it receives maximal impulses. This called neurobiotexis. It is manifested by migration of facial motor nucleus, the vagus motor nucleus, ambiguous, resulting in binding of axon emerging of this nucleus. Some of nuclei of dorsal lamina, mostly extrapyramidal, migrate as ventrally, as the olivary nucleus of medulla, pontine nucleus of Boone, red nucleus, and substantia nigra in midbrain. General cranial embryology, development of lumen of the brain, formation of a fourth ventricle. In the rhomboencephalon, Alar lamina of both sides move away for each other as opening book, leading to widening of the lamina, thus forming fourth ventricle. The thin roof plate becomes stretched and rhomboid in shape, extending laterally from the lateral recess of fourth ventricle on each side. Vascular mesenchymal lining in contact with outer surface of roof plate from pia mater and the two layer from telechoroid, which send vascular projection to cavity of fourth ventricle to form choroid plexus. Development of lamina of the brain. Local representation of roof plate lead to formation of median foramen of Magendie to lateral foramen of Loschka. Formation of cerebellar aqueduct. The lumen of the mesencephalon become much reduced due to thickening of the wall. It transformed into central canal called the cerebellar duct of Salvius. The cerebellum is formed of dorsal part of the olar lamina of the mesencephalon. Development of the cerebellum. The olar lamina of both sides bind medially to form the rhombic lips, forming the medial and lateral bulk. The medial bulk of both sides meet together over roof plate of fourth ventricle and unit forming vermis. The lateral part growing forming cerebellar hemisphere. The cerebral cortex formed by migration of neuroplasts from mental layer of to enter the marginal layer. The dentate nucleus develop as collection of neuroplasts which remain deeply seated in the mental layer. The cerebral peduncle develop. أوبا. ماشي غلط غلط. Cerebral peduncle developed of cerebral nuclei going out of the cerebellum to reach the brainstem. Development of a forebrain. It is the most cranial of three brain vesicles. Lateral diaphragm appear on each side of a brain, called optic vesicles, divided in forebrain to rosencephalon, a telencephalon. Cranial part of the forebrain include two lateral diverticula. It gives two lateral outpoking forming cerebral hemisphere, while optic vesicle and its sulc will the form of retina and optic nerve. Diencephalon, the part immediate called to optic vesicle, it develop the isthmus, hypothalamus, epithalamus, pineal body. The staging of neural tube. First stage, 3 vesicle. Second stage, 5 vesicle. Third stage, 3 flexures. Development of the cerebral hemisphere. The two cerebral hemispheres arise as two evagination from lateral wall of the forebrain, prosencephalon. The cavity of each evagination expands from lateral ventricle. The wall of each hemisphere is formed of outer marginal layer formed white matter, middle mental layer formed nerve cell neurobuses, inner epidermal cell lining the cavity of the lateral ventricle. As development process, the following change occurs. The neuroblast of the wall of hemisphere except the base marginate from the mental layer to marginal layer forming gray matter of cortex and axons of these neuroblasts invade the rest of the wall forming white matter of cerebral hemisphere. The neuroblast of layer of base of hemisphere not migrate marginally layer but remain deeply seated forming mass of gray matter corpus striatum, part of mid wall of hemisphere just above the roof of third ventricle is invaded by choroid plexus forming choroid fissure. Development of cerebral hemisphere. Expansion of cerebral cortex in all directions resulting mid-surface of two cerebral hemispheres come very close each other. Corpus striatum at the base of the hemisphere is pushed toward thalamus but keep separated from it by fibers of internal capsule insula which appear on the surface as an area of less active growth become buried deeply to the surface by surrounding activity. Growing parts, the cerebral hemisphere overlap the brainstem and cerebellum. clinical correlation دي حاجات هيتكلموا عليها الإخوة الزملاء. Holoprosencephaly refer to spectrum of abnormalities in which loss of mid-structure result in malformation of the brain surface. Is severe cases, the lateral ventricle margin into single telencephalon vesicle lobar holoprosencephaly. The eye are fused and there are single nasal chamber along which the other midline space defect. Schwanencephaly is rare disorder in which larger clefts occur of cerebral hemisphere, sometimes causing loss of brain tissue. Meningeocele, meningoencephalocele, and meningohydroencephalocele are caused by suffocation defect of the bone of the skull. The most frequent affected bone is squamous part of optical or occipital bone, which may be partially or totally lacking. If the opening of occipital bone is small, only meningeal bulb through meningocele, but if defect is large, part of brain and even part of ventricle may be present through the opening of meningeal cell. The later two manifestation are as meningohydrocele وmeningocele respectively. The defect occur 1 لكل 2000 ولادة. ده شكل الهيدرومينجوسيل، المينجوسيل، المينجوانكيفالوسيل. clinical defect correlation. Encephalocele is characterized by failure of encephalocele part of a neural tube to close. As a result, the valve of the skull does not form, leaving the malformed brain exposed. Later, this tissue degenerated, leaving mass of necrotic tissue. This defect is called an encephalocele. Also, the brainstem remained intact since the fetus, like the mechanism of swallowing. The last month of pregnancy are characterized by hydronemus. Abnormality can be recognized as a radiograph since violet of the skull is absent. An encephalocele is common abnormality 1 ل 1500 that occur 4 times more than often female in the male. Being spina bifida, like spina bifida 70%. Hydrocephalus is characterized by an abnormal accumulation of cerebrospinal fluid within ventricular system. Aqueduct of Salvius stenosis. This prevents cerebrospinal fluid from lateral ventricle. Arachnoid Arnold Chiari malformation is caudal displacement and herniation. Microcephaly description. Cranial vault that similar than normal. Toxoplasmosis. Agreed. Many other CNS defect may occur without much external manifestation. Corpus callosum. Goodbye.